best practice management and patient engagement software of 2026. Running a healthcare practice means the front office never stops. You're scheduling patients, fielding calls, chasing confirmations, collecting payments, and trying to keep your team on the same page. That's where practice management software comes in. In this video, we'll break down what to look for in the best practice management and patient engagement software in 2026. And we'll spotlight Weave, a platform purpose-built to unify all of it for practices of all sizes. This episode is sponsored by Weave, but as always, we're keeping things fair, data-backed, and buyer first. Let's dive in. What to look for in practice management and patient engagement software in 2026. Most practices aren't failing at patient engagement on purpose. They're operating with tools that weren't designed to work together. A phone system that doesn't know who's calling, reminders that go out but don't allow replies, billing that lives in a separate portal patients rarely visit. Here's what separates platforms that improve staff and patient experiences from ones that don't. Unified communications across every channel. Patients are able to communicate on their own terms. They can call when it's convenient, text when they're running late, and expect a fast response either way. The right platform unifies phone, text, and email in a single interface, so your team isn't toggling between systems and patient conversations don't get lost. Automated touchpoints across the full patient journey. The best practice management software automates outreach at every relevant moment. Appointment reminders, confirmation requests, recall messaging for overdue care, patient reminders after a visit, and review requests while the experience is still fresh. Payments embedded in the communication flow. Disconnected billing is a patient engagement failure. When a patient has to log into a separate portal to pay a balance, friction is high and collection rates suffer. Look for platforms that let patients pay directly from a text or email link with options for payment plans and buy now, pay later for larger balances. Reputation management. Online reviews are critical for word of mouth and acquiring new patients, but most satisfied patients won't leave one without being prompted. Practice management software should make review collection part of the routine post-visit workflow and give your team efficient tools to respond to reviews consistently and professionally. Analytics that tell you what's happening. The strongest platforms give practices visibility into call volume, missed calls, patient sentiment, schedule performance, and revenue data. So decisions about staffing, outreach, and follow-up are based on real information, not instinct. Spotlight on Weave, omnichannel patient engagement and communication in one platform. Weave is an omnichannel patient communication and VoIP platform built specifically for healthcare businesses. It integrates with practice management solutions and brings scheduling, payments, reputation management, AI-powered tools, and more into a single interface, so every patient interaction happens in one place. Here's where Weave stands out in 2026. Calling and two-way messaging. Weave's VoIP phone system anchors the platform. Call Pop surfaces patient details the moment a call comes in, so staff can greet patients by name without switching screens. When a call goes unanswered, Weave automatically sends a missed call text, a feature multiple reviewers credit with retaining patients who would otherwise have moved on. On the texting side, messages are visible to the full team in real time, so whoever's available can respond quickly. Automated reminders, recalls, and confirmations. Weave automates appointment reminders and confirmation requests with logic that accepts any patient response, not just a specific code, reducing the friction that causes patients to not confirm at all. Recall messaging keeps overdue patients from falling off your schedule. Reviewers across dental, veterinary, optometry, and medical practices consistently highlight how automated outreach has improved schedule fill rates without adding to staff workload. Payments built into patient communication. Weave's payment suite includes text-to-pay, online bill pay, card on file, payment plans, Google and Apple Pay, and buy now, pay later through Care Credit. A practice administrator on G2 described the ability to text a patient a payment link as an AR dream, not just for convenience, but because it collapses the time between sending a statement and collecting payment. AI tools that reduce front office load. Weave has several AI features that address day-to-day friction points. Call Intelligence analyzes call recordings for patient sentiment, identifies missed revenue opportunities, and generates written transcriptions, giving managers visibility into every patient call without listening manually. The email assistant helps staff draft branded patient communications quickly, and the response assistant generates replies to online reviews. An AI receptionist, currently in early access, handles 24/7 call and text conversations, appointment booking and rescheduling, common patient questions, and follow-up task generation based on patient requests. For example, if a patient asks for insurance information, AI receptionist creates a task for the team to follow up with the relevant details. In summary, Weave is a strong fit if you run a healthcare practice, specifically in dental, optometry, veterinary, physical therapy, med spa, primary care, or similar. You're tired of patching together phones, reminders, and billing across tools. Missed calls, calls, slow follow-up, or payment friction are costing you patience and revenue, you want automated patient engagement without adding headcount. For practices of all sizes, Weave is one of the best patient engagement platforms available today. To see how Weave can help practices like yours, schedule a demo through the links in the description. I'm Devin Hennig with SelectHub. Thanks for watching, and we'll see you next time. Cheers!